All right, guys. Today we'll be talking about epinephrine. We'll cover what it is, some indications for the drugs, some dosing, and some side effects to look out for. So starting off, we'll just start here with what is epinephrine. So epinephrine is it's primarily used and classified as a vasopressor. What this means, being a vasopressor, this means that this medication is going to be used to increase our blood pressure. How it works as a vasopressor is it works as a alpha 1 agonist. So being alpha 1 agonists, alpha 1 receptors are going to cause vasoconstriction of your vascular system, which is going to lead to your increased blood pressure and your increased MAP. Along with being a vasopressor, it also has some function as a positive inotrope. And what a positive inotrope does, this is going to cause an increase in contractility. So it's going to increase a harder squeeze and increase in heart rate. And it does this because it acts as a beta 1 agonist. So what beta 1 does, beta 1 affects the heart, and these two symptoms here. So increased contractility and increased heart rate, and both of these are going to work together. That's going to increase your cardiac output. It also has some other functions like in anaphylaxis and stuff as well, but for the ICU, these will be your two main indications or why you're using it for. Speaking of that, we'll just go down here and list out indications. Okay, so common indications are going to be things like hypotension. Remember we talked about how it will use the alpha 1 agonist, so it will cause increase in blood pressure to correct that. It's also part of the ACLS algorithm, so you'll see it in cardiac arrest, vasoconstriction, help get perfusion back to your organs. You could see it in heart failure. That's even maybe progressed to cardiogenic shock. And how it benefits here, this is due to that beta 1 agonist, right? So the increase in heart rate, increase in contractility is going to increase your cardiac output to help combat that heart failure. And you could also see it in symptomatic bradycardia. Same thing here. Gets this used for also, once again, being the beta 1 agonist. Similarly to norepinephrine, the alpha 1 agonist, it's pretty strong alpha 1 agonist, but the difference between epi and norepi is epinephrine is a much stronger beta 1 compared to norepinephrine. As far as dosing for epinephrine, common dosing, this is with the IV, continuous IV infusion. It's going to be 5 to 30 mics per minute. And, for, ACLS, you'll have your IV push, which will be your 1 milligram that you'll get very comfortable with using in code blues and all the cardiac arrests you'll have in the ICU. As far as things to monitor for and some adverse effects, well, the main one here is going to be you'll get excessive vasoconstriction from that alpha 1. So this could lead to extreme hypertension and also decreased organ perfusion. So other things to monitor for are going to be tachycardia. Remember, especially if you're starting this on a patient who maybe they're hypotensive, but they're already, a little tachycardic, you want to make sure, because that beta-1 activation, you don't want to cause, excessive tachycardia there. And along kind of the same thing as tachycardia is just arrhythmias, just kind of increasing the excitability of the heart with that beta-1. So you can look out for, things like PVCs, maybe short runs of VTAC, things of that nature. Okay, so this is just a very basic, very general overview of epinephrine. Like I said, it's a vasopressor. It also has some positive inotrope effects, mostly indicated for hypotension. You'll see it in cardiac arrest, the ACLS protocol, heart failure, symptomatic bradycardia. You got your dosing there, and things you're going to want to monitor for is, excessive vasoconstriction, tachycardia, and tachyarrhythmias as well. If you learned anything, I'd really appreciate if you would subscribe to the channel, help the channel grow. Thank you so much.